Let's talk about contraception. I think most people are probably au fait with.
Yes.
Is the pill, the contraceptive pill.
Yes. There's actually two types of pill.
Okay.
There is the combined contraceptive pill, and then there's the progesterone only pill, which is the mini pill.
Right.
The combined one currently, gosh, there's so much information. I've got to make sure I get it out. The combined one currently is the advice is to take it every 3 weeks, and then you have a week off, and then you have a withdrawal bleed in that week off. The advice is starting to change now, and we're saying that actually you can put your pill packets back to back, so you can often do 3 packets back to back and have no bleed. And there are some people now that are starting to advise that actually you don't need to have a bleed at all, and actually you can actually put them back to back ongoing, and if you want to have a bleed you just do 4 days.
Okay.
But the traditional way with the combined pill is 3 weeks and a week off.
And what's just keeping on that one?
Yeah.
What are the pros to the combined pill?
You're in control in terms of
you know when your period's coming.
Yeah. You know, if you say wanted to suddenly stop your contraception because you were thinking of having a baby at some point and you wanted to be in control of that, then you can. It's for some people it's just more acceptable. They feel in control and some people the idea of having something put in their arm or an injection
it's an oral pill that you take every day. Okay, and there's no procedure
and you're in control, so that's often why that's popular. The only thing with the combined pill, it's estrogen and progesterone, so we have to see you regularly for a blood pressure check. 6 months, sometimes a year, depending on your age and your risk factors. It's not so cool if you smoke, because your risk of having a blood clot or a stroke or heart disease goes up.
Okay.
And the basic theory behind that is that estrogen can make your blood a little bit stickier than normal, and if you smoke, that also makes it stickier. So if you have a family history of, say, a blood clot, we need to know that, and that will affect our decisions for which pill we give you. Okay. Also, if you have migraines, and a migraine with an aura, which is when you get an aura is a sensation of your migraine coming on half an hour before it develops, half an hour-ish. Or if you get a focal migraine when you lose vision, that again, with the slightly sticky blood and vessels constricting up in your brain, we would say that probably you shouldn't have the combined pill.
Okay.
So all of those.
So not everyone can go on the pill. There is actually you would advise people against it if not everything is right. Okay. And just quickly, when you come off the pill, how long can you then just start trying for baby? Is it instant?
You
so
can
some people panic, they miss a pill and they're like, oh my goodness. But if you wanted, if you were consciously going to try to have a baby, would you give yourself like a month, 2 months?
No, go for it, try, because it can take 6 months to get your fertility back to normal, but some people find they're sort of slightly super fertile that first month after coming off the pill. So a lot of people actually get pregnant straight away.
I actually think that might have been what happened in my case.
I think me too, yeah.
No one told me that, so that's actually a really important point. That you actually sort of maybe even have like a slight peak in fertility after you come off it. That's it.
Yeah. The downside to the pill is if you're sick, if you vomit, if you're taking antibiotics, then you could actually your risk of pregnancy goes up. The other thing is that, so traditionally with this kind of pill, the big kind of high risk time is when you've finished your pill packet and you've got to restart it. And actually that's a flaw in the design of the pill, because that's when people forget. And actually that's why they're encouraging people to start putting the pill packets back to back. You're 21 times more likely to get pregnant on something like the pill than you are a longer acting reversible contraception like the implant or the coil or the injection. And that is for that very reason. If you miss a pill or if you're sick.
Yeah, so the pros and cons are, the pros are that you are in control of it, but the cons are you are in control of it, so therefore
if you forget it, it's not going to work.